Welcome to NATCO Studio Room. Today I am being with a great personality and a great doctor, Dr. Sanmay Chowdhury from Ruby Hall Clinic, Pune. Sir, welcome to NATCO Studio Room. And I have some questions to ask you, and we really want your knowledge and wisdom to all of us because we are eagerly waiting to know about all the wisdom that you have.
Yeah.
So, can I ask the question, sir?
Sure. I'm thankful to NATCO for giving me this opportunity to have a conversation and can share whatever you would like to ask.
Okay. So, how does ceftazidime avibactam performing in treating hospital-acquired pneumonia caused by CRE?
Yeah. Over a period of last 1.5 years, the problem was with multi-drug resistant infections because of random usage of multiple antibiotics. We have a medical ICU which caters to a good number of case mix, including medical, surgical as well as trauma patients. And in this we found that we had primarily gram-negative infection, which was predominantly causing multi-drug resistant infections. And the antibiotics that we were commonly using were not able to combat the severity of infection that we were coming across in the intensive care unit. Primarily it was Klebsiella, it was Pseudomonas, it was E. coli and Enterobacteriaceae. That was the common culprit that we were encountering in the gram-negative septicemia. Over a period of time, this new molecule, which included ceftazidime with avibactam as the adjunct molecule, we found that avibactam was effective against all these 4 gram-negative organisms, including Acinetobacter. It was not effective against Acinetobacter, it was only effective against these 4. And the synergy testing as well as other gene expert testing showed that the antibiotic susceptibility to this avibactam was much more protracted to these organisms, especially Klebsiella, E. coli and pneumonia, and especially Pseudomonas, where we found that the sensitivity rates are pretty high, in conjunction with use of Astronam, where it was oxa sensitive. So, basically it helped us in combating these infections over a period of time, and we could spare meropenem. We could see to that meropenem resistance was combated because it was giving XDR, XDR type of pattern of a resistance pattern, so which was becoming a big problem in our intensive care unit. So, our main aim was to see to that MDR infections, particularly in the subset of patients who had received multiple antibiotics in various ICUs and then they come to us as a tertiary center, was effectively getting treated. And we found that the number of days of stay in the ICU, including the mortality and morbidity and number of ventilated days, was subsequently reduced with the use of this particular molecule, ceftazidime avibactam.
All right, thank you so much, sir. And what are the clinical indications for using Astronam in the ICU?
Again, as I told, that MDR infections were the most common, where it was demonstrated that gene expert as well as the synergy testing showed that the organism was susceptible, especially in hospital acquired pneumonias or gram-negative septicemia, especially the upper pneumonias as well as the intraabdominal infections. We found it very useful.
All right, thank you so much, sir. And how common is H3N2 in India and what is the incidence?
H3N2, we had a severe infection pattern, say 4 years back. We found that the infection pattern changed in the form of a long COVID infection, as well as there were other parameters like people developed thrombotic events, patient had residual lung damage, patient had developed neuropathy, patient also had strokes, developed acute myocardial infarction. So, in this subset of patients, we found that the consequences of COVID presented in the form of polyarthralgia. Patient developed issues of neuropathy, primarily because of the use of treatment that was done during the H3N2 infections. The rise of H3N2 infections was subsequently combated with vaccination, proper infection control measures, and then at present we find that the incidence has come down subsequently, and very rarely we come across H3N2 infections in our hospital setup.
All right, thank you. Thank you so much, Dr. Sanmay sir, for sharing your insightful thought with all of us, and it will definitely help us a lot. And thank you so much on behalf of
Yeah.
NATCO Studio Room.
I'm very much thankful to NATCO for giving me this opportunity. It's an honor.
All right.
And in
Thank
future, we shall be associated with NATCO in a better way. Thank you
All
very
right.
much.